welcome to Shoulder Injury Prevention and Rehabilitation for Fitness Professionals. Pretty standard format today. We're going to go through an hour or so of anatomy, physiology, injury prevention, or typical injuries that you will see. We'll then spend the last part of the day talking about problem exercises that you do use and have seen in gyms, and we'll talk about ways of rehabilitating and going through a stack of rehab exercises. So a lot of stuff to get through. In your notes you'll see functional anatomy. We're going to get started on a bit of functional anatomy. The glenohumeral joint is classified as a ball and socket joint. But if you actually have a look at it, in real terms, it's actually not much of a socket at all. So it is classified as a ball and socket, but if you have a look at the skeleton, there's a very, very big ball, but it's a pretty poor excuse for a socket. Now if you compare that to what's happening down here at the hip, now there we're talking ball and socket. So we have quite a firm ball here on the hip, and the socket is reasonably deep. It's very, very rare to dislocate your hip. You can do it, but it's actually reasonably rare. Compare that to how common it is to dislocate your shoulder, and that's indicative of how shallow that little space is. So some people actually talk about this as a ball and saucer as opposed to a ball and socket, because that's actually all it is. And out of any of the joints that we'll talk about, the shoulder is probably the one that you guys as fitness professionals have the most that you can do with and play with. There's a stack of things you do for lumbar spines, but structurally they're held together by a lot of ligaments and joints. The shoulder is so fundamentally held together by muscles. You can make it worse as easy as you can make it better, and you can injure lots of shoulders if you're not careful what you're doing. Okay, so and to point out how unstable a shoulder is, if you've ever seen anyone that's had a stroke or they've had a problem with the muscles around here, they will slowly dislocate their shoulder, which means over time, if their deltoid and rotator cuff aren't working here, the humerus will slowly start to drop and dislocate. And you get a huge gap in between here, and you can see it on the stroke victim because they don't have the muscles anymore to hold the thing together. Now if that happened around your knee, it wouldn't be a problem because the ligaments are really stable and they keep it together. But the shoulder is held together so much by muscles, if they don't work properly in the right order, you get dysfunction. And with those people, they actually end up having braces. They put a strap around here and it belts up and pulls the humerus up so it doesn't dislocate. It's called a subluxing shoulder. And when you see it, it's quite traumatic, because you can see this huge drop step down here where the humerus used to be. And that just points out how inherently unstable the joint is and how important the muscles are at keeping it together, which is why you guys can have a lot to do with it. So it's really good to play with. Let's have a look at some anatomy. We go into your notes. Static stabilisers are many and varied. What I mean by static stabilisers are basically things that are held, basically designed to hold the shoulder together statically. And in your list there, you'll see the joint capsule, which is that connective tissue that binds around the whole shoulder and holds it together. That's the joint capsule. And that's an example of a joint capsule here. This joint capsule and the glenohumeral ligaments combine to hold it together. So we've got the joint capsule, glenohumeral ligaments, and there's a thing called the glenoid labrum. The labrum is a ring of fibrocartilage which just sits around the socket to make that socket a little bit deeper. Okay, so it's a rim of fibrocartilage that sits around the socket to try and make that thing a little bit more secure and more stable. You'll sometimes hear about people having a labral tear. Okay, so they tear that little rim where it sits around, and its job is pretty well to make the socket deeper. Okay, so they're our static stabilisers. So joint capsule, the glenohumeral ligaments. You see our glenohumeral joint capsule on this. See how it just binds around? Ever heard of a thing called capsulitis? Capsulitis is an inflammation of this joint capsule, and it can really bind up the shoulder. For some reason the whole shoulder, the whole capsule tightens up. You see people that come in who can't move their arm and can't do this because the whole thing is just bound up.